Joining us now is Democratic Congressman Anthony Weiner of New York. He sits on the House Energy and Commerce Committee and the Health Subcommittee. Congressman Weiner, it's nice to see you not on a Friday.
It's my pleasure. Thanks. Welcome to Queens.
Thank you. Are you standing in a median right now?
No, it just seems that way. It's Utopia Parkway.
Very good.
But I'm thin enough they wouldn't hit me anyway.
All right, fair enough. Listen, you and I have talked a number of times about misinformation about health reform coming from Republican members of Congress. I now have to ask your reaction to the Republican Party itself sending this survey to people asking whether they think health care reform might be a plot to deprive Republicans of medical care. What's your reaction?
Well, the Republicans are so furious about trying to stop any type of reform at all that they're about to self-immolate. It seems like they'll say or do just about anything. You know, you have the chair of the Republican National Committee putting out the most vigorous defense of a single-payer health care plan I can imagine, and then quickly running away from that very notion. And then today, the idea that your voter registration form is going to be used to somehow to pull the plug on Granny. Look, the bottom line here is that the Republicans and many folks on the right fundamentally don't believe that government should do anything to try to solve the problems of this country. That's why they lost the House, they lost the Senate, they lost the White House. But now there's a team in charge, and the Democrats, we're not getting everything exactly right, and I've had some problems with some of the steps we've taken. But to say that we don't need to try to fix health care and that somehow this is an assault on our Constitution or on our way of life is just absurd, and I think more and more Americans are seeing that.
As we're coming down to the end of the August recess, is it your sense that Democrats have realized that they may have to go it alone on health care reform, that they may not get any Republican votes, at least from where they were expecting them? And do you think that any Republicans are leaning towards supporting health reform?
Well, let me just make it clear that I think there are a lot of Republican citizens of this country who understand this problem a lot better than their leaders do. But it's also fairly clear that the Republicans in the Senate and the House think that the only way that they can gain any traction and get back into the majority is by simply voting no on everything and being a general no party. If that's the case, we can't afford to just keep sitting around negotiating with ourselves. I can't remember the last time I saw a Republican member of the United States Senate stand up and say, here are the things I'd like to have in a bill. All I've heard them say is what they're against.
Do you think that Senator Kennedy dying this week is going to have a practical impact on what a final bill ultimately looks like? He, of course, was the chair of the Senate Help Committee. Is it possible that that bill more traction now as opposed to the one that's been held up for so long in the Finance Committee?
I think the act of legislating in this issue is going to be just as hard with or without Senator Kennedy of blessed memory. But I will say this. I think that more and more people reading about Senator Kennedy's life, reading about things like the Americans with Disabilities Act didn't just happen. It was widely opposed by many in Congress. The idea that Medicare itself was opposed by many people in Congress and many people today, and that these things had to overcome similar types of scare campaigns that we're seeing today. Just seeing that history written for people and seeing them have a chance to see it on their local television and read about it in their newspapers, I think it is going to improve the conditions for this debate. I think a lot of Americans realize that what Senator Kennedy offered was ideas on how to improve people's lives, and that's what this discussion should be about.
From that big picture perspective, you, of course, have championed the idea that a single-payer option, a single-payer program ought to still be on the table. It ought to be one of the things that we are discussing when we're thinking about how to reform health care. How goes your fight to keep the option of a single payer alive?
Well, I would point out that the notion of Medicare for all Americans was something that Senator Kennedy was carrying in the United States Senate. Increasingly, as we see arguments like the one that you had carried out on your show at the top, you know, people like the head of the Republican National Committee arguing on one hand that he loves a single-payer option, on the other hand he loves it only up to a point, has gotten people to think about what makes Medicare a success. Sure, it has financing problems, but we know, for example, that every dime that goes into Medicare goes into health care and doesn't go into profits and overhead. So we're gaining traction. Now, it's going to be tough, but frankly, it's going to be tough to get anything done. But I'm comfortable making an argument. You know, I want to step back and watch Steele argue with himself for a while. That seems to be the best case for single-payer health care.
Democratic Congressman Anthony Weiner of New York, thanks again for your time tonight, and make sure somebody gets you safely out of traffic there, okay?
Thank you.
Thanks.